everybody, I'm Maggie, and we're here on a segment of SRH Access Facebook Live. Today, we're in our Frisco campus with our sports medicine physician, Dr. Shane Miller. Welcome.
Good morning.
We're excited. We haven't done this in a couple of weeks, so we're happy to be here and chatting with you this morning.
Great, thank you for having me.
Yeah, definitely. So this morning, we're excited to talk about concussion management. School's back, sports are back. What's going on with that?
So, concussions are constantly evolving in the way that we're managing these. Fortunately, there's a lot of researchers and institutions like ourselves around the world, really, that are researching. And we're finding that the way we've been managing them even 5 years ago may not have been the best way. And so there's been constant evolution and updates. I think one of the biggest changes recently is we're taking a much more active approach to both rehabilitation and recovery from these injuries. We used to kind of just sit and wait for the brain to heal, but we're much more early on trying to get the athlete back to normal non-sports activities after just a couple of days of rest at most, as opposed to prolonged rest, which seems to really slow down their recovery, take them longer to recover. And so getting them back into school, getting them back into some early physical activity. If we're identifying issues where we're actually rehabilitating the brain, similar to if you would have a knee injury, we rehab your injury, right? And so same thing with the brain. So it's a much more active approach, which I think is exciting for us because we feel more empowered to be able to actually help and do things rather than just sitting and hoping that they'll get better.
Right, that's awesome. And it's good to know. I think with our research and everything, like you said, evolves, and it's such a tricky injury because it's not like, oh, my knee just dislocated. It's hard to detect, it sounds like.
It is, definitely.
Yeah. So what are some of the challenges that you're seeing with concussion management?
I think there's several challenges, and right now you mentioned we're back in school, and the kids are back, and so that adds a whole different dynamic to things, because when you get hurt over the summertime, you're maybe out of your sport for a little bit, but you're not challenging your brain as much. And right now, not only is school challenging to the brain, but also if they're not challenging their brain, then they're falling behind, and that's stressful. Right? And so a lot of our students, especially the ones that are good student athletes that care about their grades, and they worry about falling behind. So we really are working on what we call return to learn, which means getting them back into school early on. And so we sort of focus on that, help them reintegrate early rather than these prolonged absences, so that there's not as much missed work. And how can the school environment support them as they kind of get back in there? And if the school is not as supportive, then that makes it a challenge for them as well. So I think that's one of the challenges that we have. But there's been a big change, even in the past 5 years or so, that the schools are much more aware of this now, and they're much more supportive of the student athletes. So I think the environment there is good. On the sporting fields, I think one of the challenges is underreporting, meaning that athletes don't want to tell us when they have a concussion, and that's not universally true, but we find that we treat hundreds of patients with concussions every year in our sports medicine center here, and we find that about 40% of them didn't report their injury at the time that they got hurt, and there are various reasons for that, but those are the ones who actually make it to us. Right. So there are some that never report their injuries and just kind of push through it because they want to keep playing, or they're worried that they're going to miss time. And I think that is a big challenge for us, both at the individual athlete level, but also culturally, nationally, is how do we make some changes there? Right,
definitely. I know that throughout the year you're always educating coaches, other healthcare professionals, and even some parents and athletes. What can you kind of tell us about what you're telling them about concussions?
I think that this is one of those things where it has to be at all levels. And so we really do. It's one thing if the medical professionals understand it. There's a law in our state that says that you have to come out if you're injured and you can't go back the same day. So the legislature understands it. But if at the athlete and coach level there's not changes, and so that's where we try to engage with the community and hope that parents and coaches continue to spread that message themselves. But like you said, we are trying to get that message out across the board is when there's been an injury, the sooner that we're aware of it, the better we are able to help rehabilitate you safely. And that's part of what's making the sport safer. I think people have a lot of concerns, a lot of us have concerns about what are the risks of concussions, over the course of the lifetime, the long term and the cumulative risks down the road. And one of the issues is that the way that concussions were managed back in the 60s and 70s, when a lot of these athletes who are playing, who are now having concerns, is very different than the way that we're managing. Like I said, it's different than we were managing it even 5 years ago. So our management now of these concussions is hopefully we're making a difference and making it safer so that when they do return to play, that they're not at increased risk of getting back. But if we're not aware of the injury, they keep playing through it, then that makes it a real challenge for us.
Definitely. I know next week we're entering into the campaign of Team Up, Speak Up.
Yes.
It's definitely something that I know our hospital really is involved in. So can you give us a little info about that?
So Team Up, Speak Up is essentially the message of trying to reach the athlete level. And last week, and as an example, a varsity high school football player, I heard a story that the varsity quarterback, who's certainly a leader at his school and his program, during practice, one of his offensive linemen had an injury and he was stumbling around and off, and because it's in the middle of the play, he's the one who notices that. They're back in the huddle together, and he said, "Coaches, you guys have to get him out. There's something not right with him. Please check him." And that takes a lot of courage to do that. But that's a really good teammate that can identify that and say, "Hey, I'm worried about my teammate," because they may not be telling the athletic trainer or their coaches about their symptoms, or they may not even be aware that they're having symptoms.
Right. And
so the Team Up, Speak Up is you're being a good teammate by helping identify and speaking up if you're concerned that maybe somebody else has a concussion. That helps us identify it. There are times, tonight I'll be on the sidelines of a local high school football game, and there are times where I'm watching as a sports medicine physician, and there's an injury that occurs that I may not be able to see. So I don't expect the coaches and the parents and the medical professionals to always know, but a lot of times the teammates do. And it's not just football; it's soccer, it's every sport that's going on. Is be fair, or maybe at school the next day. Somebody's complaining about symptoms and they're reporting them during class. They're having headaches and having difficulty concentrating and other issues during class. It's a good thing, and again, it's sometimes it's a little scary to speak up, but you're really being a good friend and a good teammate by doing that.
And that just goes along with some of this culture shift. I mean, having athletes feel comfortable saying something and protecting their fellow teammate.
That's right. I think that understanding that a concussion is a brain injury. And so that's very different than toughing it out and playing with. If your ankle's a little banged up or your knee's a little banged up, you may do some damage there, but that's very different than the brain.
Right.
Even in the sports medicine world, we understand that there are times where we're going to be able to brace you and get you back out there in a safe manner, but the brain is not one of those. And so that athlete mentality does need to shift a little bit, and they have to have the support from the coaches that they're not going to be, they're still going to have their position, they're still going to be respected and be treated appropriately as they get back, because there's some of that fear. And I do think a lot of the coaches have gotten that message and are doing a great job, but it certainly is not present universally.
Right. We're making progress.
We're making progress, which is a good thing.
Well, that's great. Well, I'm so glad that we were able to have this talk and get an update on concussion management, and good luck with everything, and we're so proud and we're excited that we have the resources here and the passion that you have.
Thank you.
To take care of athletes. We'll see you next time. Thank you.